The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello again, TMD warriors, both professionals and patients. We are here for the next episode of TMD Demystified. My name is Tony Urbanek. Today's topic is very important to me, and hopefully will be very important to you in understanding this disease much better than it has been understood in the past. I'll try to be as concise as I can about this, but the title of today's episode is TMD is one disorder, not several disorders. And I will go on to explain. There is a huge difference between what has been considered temporomandibular joint disease over the past 70 years and what I admittedly, and I take full credit for it, right or wrong, what's really going on with this disease, which in summary is inflammation within the joint creates all the symptoms. I've said that many different times, different episodes explain how that occurs, but if you can diminish, decrease, get rid of the inflammation within the temporomandibular joint, not magically, but scientifically and physiologically, all the symptoms go away. That is a fact. That is why non-steroidal anti-inflammatories work so well, but for just a very short period of time. This is a fact. Everyone agrees. Everyone knows that non-steroidals will decrease the symptoms of TMD. Unfortunately, non-steroidals don't work very long. They run out of steam. Everybody agrees to that. That is well known. Why more emphasis has not been put on during the past 70 years, how other ways to get rid of inflammation is a mystery to me, because once I started doing my review and investigation and found out what was really going on, it just floored me to actually realize that no one has actually looked at inflammation as the primary cause of the problem, and then looking at chronic inflammation as the ultimate solution. But as we well know, if you rest a joint long enough, inflammation will decrease, whether you're talking about a hip, a knee, a elbow, or the temporomandibular joint, if you can rest it. And the problem with the temporomandibular joint, it is extremely difficult to rest the joint because you have to speak, you have to chew. A lot of people brux, half the population bruxes, clenches and grinds. And so resting the temporomandibular joint once disease damaged is a technical problem, admittedly. But we figure that out by using a device that unloads the temporomandibular joint. Simple, that's all it does, unloads the temporomandibular joint and use it according to a protocol as a tool. But I'm getting a far field here. Today we're going to talk about TMD as one disorder, which I've just explained. The disorder is chronic inflammation within the temporomandibular joint. As I've spoken before, each episode each week is based on a blog that I write on Sunday night every week. My episode is always recorded on a Tuesday morning, and it's based on a Sunday night 2-page blog that I write every night. The blog is distributed to members of our network of doctors who use our patented, FDA-cleared, university-tested device and protocol, and also is distributed to other places, including our website and patient lists, referral sources, where this blog is directed. But today, what I'm going to do, what I almost forced to do, because I spent a lot of time thinking about exactly how to portray this topic, I'm going to read Sunday night's blog for you, and I'll try to do it at a pace that will make sense, that you can follow me along and understand. Again, the title is TMD is one disorder, not several disorders. And after I read it, then we're going to discuss it, because the time has come, because of what we see in this practice, the great number of patients who present to this practice with 10, 20, 30 years of being run around in circles by other providers. I have to assume each of them have good intentions, but many providers run around in circles for decades trying to come up with solutions to their symptoms that are all related to TMD. There is no doubt that the symptoms related to TMD are very varied. They're disparate. They're all over. They come and attack and address the entire head and neck and upper shoulder girdle, all the way into the arm. Those are the well-known symptoms. And the problem is, up until now, no one has been able to make sense of all those symptoms until I didn't find the common denominator. The common denominator has already been there. The common denominator is inflammation, as I've said. Chronic inflammation is handled by nonsteroidals for a short period of time, but instead of looking at chronic inflammation, everyone has tried to just treat symptoms. So TMD is actually one disorder, but let me read the blog, and then we'll discuss certain parts of this. If you read the textbooks on TMD or Google TMD, temporomandibular joint disorder, you will read or see that mainstream dentistry considers TMD as a series of similar but unrelated disorders. The reason they do that is because they are just trying to treat symptoms, and they're not haven't even been looking for a common denominator, a common source. There is even a new specialty in dentistry that has been designated oral facial pain, OFP, by the American Dental Association. The thought process making oral facial pain a specialty goes something like this. For decades, the medical and dental profession have not been able to figure out the cause of the unusual pains associated with the head and face, except for the most obvious ones, including tooth decay and infection, ear infection, brain tumors and strokes, and various kinds of head and neck cancers. 2, if we can't figure out what is causing the unusual and less common pains, it must be complicated. 3, if it's complicated, then it needs to be treated by a specialist. This type of logic has several inherent flaws. The most glaring and egregious one is, just because you can't figure out something doesn't make it complicated. It just may be they don't understand some important data that is required to make the solution to the problem rather simple. So recently, dentistry has started going in a whole new direction in treating oral facial pain. Instead of doing the basic research looking for the common denominator, which might be responsible for causing all the various and disparate symptoms associated with facial pain, Professional political groups have been talked into making the problem more complicated than necessary and creating a whole new multi-tiered educational process that relies on and centered around old, worn-out theories. This move by the ADA has complicated the whole area to the extent that there are now 3 OFP organizations competing to certify dentists as specialists: the American Academy of Craniofacial Pain, the American Board of Oral Facial Pain, and the American Academy of Oral Facial Pain. This is totally confusing and unprecedented in dentistry. Each of the actual tried and true specialties in dentistry, for example, oral and maxillofacial surgery, children's dentistry, pedodontics, endodontics, root canal doctors, periodontists, only have one certifying board each. What is going on is confusion added to a conundrum which is surrounded by a mystery. The whole problem was generated by the dental schools for the past 70 years, teaching that the temporomandibular joint, TMJ, is a very complicated joint, unlike any other joint in the body. This is and was the original falsehood which led to everyone thinking any unusual pain in and around the face must be complicated. The joint's complicated, so the problem's complicated, so the solution's complicated. That does not hold true logic. The truth is, almost all unusual facial pains, emphasize unusual, because there are some well-known usual facial pains. The truth is, almost all unusual pains of the head and neck, not explained by the more easily diagnosed problems, are generated from inflammation within the temporomandibular joint. So-called OFP, orofacial pain specialists, the ADA, dental schools, and the dental establishment in general have not read and applied the basic science information already available. And I'm speaking basic science on how joints work, how the inflammatory system works, the relationship of the inflammatory system to the nerve system, the neural system, and the endocrine system. This is all basically already worked out in the basic sciences, which is not even looked at by those prior noted groups.